afternoon, everyone, and welcome. My name is Champika Nicholas, and I'm a research assistant here at Osler Research Institute for Health Innovation, also known as ORIHI. I'm excited to welcome you here for today's special speaker series event to celebrate Medical Laboratory Week. For those of you who may be joining us for the first time, ORIHI is dedicated to advancing patient-centered research and innovation across William Osler. One area we're especially proud of is our work in advanced cancer diagnostics, where lab professionals are playing an increasingly critical role. This week, from April 13th to 19th, we join colleagues across Canada in recognizing the vital contributions of medical laboratory professionals. They are essential to patient care, from delivering accurate, timely diagnostics that guide everything from routine tests to life-saving cancer treatment. To mark the occasion, we are welcoming two outstanding guests. First, Cassandra Macaulay, the Chief Research Officer at the Colorectal Cancer Resource and Action Network, or CRAN, where she leads patient-focused initiatives in research, advocacy, and education. And joining her in conversation today is Andrea Beharry, the charge technologist of advanced diagnostics at William Osler. Andrea has been instrumental in expanding Osler's biomarker testing services, and we're so lucky to have her share her experience with us today. With that, I'll now hand it over to Cassandra to get us started.
Oh, thank you so much for the warm welcome, Champika. I would like to just start by extending my gratitude to the Osler team for the invitation to join you today. I'll take a brief moment to just introduce CRAN and our work in the biomarker space as we just get started with this conversation today. So CRAN is a national patient-focused organization who champions the health and well-being of Canadians touched by colorectal cancer and others at risk of developing the disease. We provide support, education, and advocacy to patients as well as their caregivers to help improve both quality of life and longevity. CRAN's overarching mission is to reduce the burden of cancer in Canada. And as such, we have actually expanded our patient-focused mandate across tumor types. One of our key initiatives within our pan-tumor focus is related to timely and equitable access to advanced biomarker testing in cancer care, which is why I'm so excited to be a part of this conversation today. Our team at CRAN is certainly celebrating MLT Week, and we recognize the critical work being done in labs to support cancer patients. And with that, I'm very pleased to hand it over to your very own Andrea Beharry to introduce herself.
Thank you so much, Cassandra. Hi, everyone. I'm Andrea Beharry. I'm the charge technologist for the Advanced Diagnostics Department here at the William Osler Health System. And thank you so much for having me and for the invitation to speak. I'd like to say a happy MedLab Week to all our technologists. And as you mentioned, it's a time to recognize the vital role that we as lab techs play in delivering quality healthcare. And you know, while often our work may happen behind the scenes, the impact is front and center in every patient's care journey. So I'm thrilled to be here to tell you a little bit about who we are and what we do.
Thank you so much, Andrea. As we were preparing for this discussion today, we realized that you and I are both alumni of the Michener Institute.
Right.
And, as is common in allied health, medical lab technology isn't necessarily, a career path that is, let's say, prominently featured or sometimes even considered as an option for young Canadians looking for a career. So I'm always interested to hear how professionals get into these kind of lesser known career paths. Andrea, can you tell us a little bit about what inspired you to get into this field?
So I have a science background, but when I was in university is when I got my first taste of the lab. So I worked in a research department during my university years. I had never heard of MedLab and had no idea those courses even existed. And oftentimes they would send me down to the clinical lab to use their instrumentation. And I went down there one day and I thought, oh boy, there's a whole other world down here that I know nothing about. And it really piqued my interest. I love creating new assays. And I started off in the research lab washing their glassware. And by the time I finished 4 years later, I was creating and developing new assays myself. So I really liked the research part of it. And I thought to myself, this is what I want to get into. I want to get into the lab work. And I went and I talked to the techs down in the clinical lab, and they were the ones who told me about the Michener Institute and the MedLab program. And that's how I kind of got started in it. So, you know, it led me down that career of MedLab, eventually as a histology and a molecular technologist. My real passion is immunohistochemistry. For me, it's a bit like detective work where we use, you know, various antibodies to identify specific proteins in tissue. And I just love creating new assays for this.
What a wonderful journey you've had to get to this point, and I'm sure it will continue to grow and flourish. Can you tell us actually what actually is a medical laboratory technologist?
So a medical laboratory technologist, we are the technologists that work in the lab, and we process patient samples. They could be blood, they could be urine samples, samples from microbiology, and in the area that I work in, they are tissue samples or little tiny biopsies. And what we do is we will process the tissue. We will cut and stain it, put it on a slide for a pathologist to read to make a diagnosis for a patient. We also have other departments within laboratories, such as transfusion medicine, and those technologists would do blood typing for transfusions or, you know, surgeries, things like that. So it's a vast area of a lot of different specialties that encompasses what a med lab technologist is.
Thank you so much for that explanation. And then just kind of bringing it back to the cancer care aspect, which is the aspect that you work in. So for those watching without a background in laboratory medicine, can you tell us a little bit about what a biomarker is in the context of cancer care and how you detect and diagnose them?
So what a biomarker is anything that you can measure in the blood or other body fluids, or in tissue samples such as biopsies. And it gives us a clue as to what's going on in the underlying disease process. It doesn't have to be cancer related, and probably the best example of a biomarker is the pregnancy test or the beta HCG. And this is a protein that can be measured in blood or urine, and if it's present, it means that the person's pregnant. And the same is true for a person's cancer. By measuring these biomarkers, we can help give the clinicians a clue as to what's going on with the patient. And they can help the oncologist or physicians to diagnose, monitor, and select the most effective treatment based on how your cancer is behaving. And biomarker the testing can be done in a number of ways. So traditionally, cancer is diagnosed by the pathologist looking at cancer slides under a microscope. Breast biomarkers, for example, it looks at the HER2, estrogen, or progesterone receptor proteins in a tissue sample, and we can see this we can see where they are in the cancer cells, because they're being visualized by an IHC assay on a microscope slide. But the other method is through genetic testing. And this is where we're not just looking at the cancer cells, but we're looking at what's going on inside of them, what's driving them to turn into cancer cells. And if we can identify those changes and provide that information to an oncologist, they can match that with a targeted therapy that can undo or inhibit those changes that made the cell turn cancerous in the first place. And this is the kind of testing that the Advanced Diagnostics Department here at William Osler is performing.
That's remarkable, isn't it? Just the science behind everything. And just to kind of bring back or reinforce the patient perspective, which you spoke to, Andrea. So the results of the biomarker testing are helping to inform treatment selection. So essentially, which type of drug therapies will work best for their particular tumor. And for patients, having these results in a timely fashion is of critical importance to individuals maybe newly diagnosed with cancer, and they can often benefit so much from biomarker informed precision medicines. So the work that your lab is doing is just so very critical for patients. And then speaking of your lab, what does a day in the life of a lab tech look like in your center?
Well, in our department, the day starts very early for our techs at 6 a.m. and typical routine, they will come in and there are already about 120 slides waiting for our technologists to screen and review and carefully screen for quality assurance issues before they hand it out to the pathologist. Simultaneously, at the same time, our molecular technologist is also beginning to prepare for the day's run. And they are starting with their extraction of their cases, the extraction of nucleic acids, and they're preparing the patient tissue for genetic sequencing. It is very high-paced volume in our department, and our techs are stellar multitaskers because we have new patients, new test orders coming in every hour. Occasionally, they are blood samples. They're arriving hourly, not just from our own clinicians, but from across Ontario. And I have a fantastic team. They can process, we typically process and stain over 500 to 600 immunohistochemistry slides and probably sequence upwards of 20 patients every single day. So it's a very high-paced volume in our department.
Wow. So as a lab tech, you're not necessarily spending your entire day looking through a microscope then, as some people might assume.
We are not. They are the ones who are actually starting to prepare the tissue, whether it's going to go for immunohistochemistry or it's going to go for molecular sequencing. Those are the technologies that they are the starting point for those samples.
Sounds like very varied work experience to be able to do all those different tasks, and the ability to multitask, as you said, sounds really important as well. Now, one of the things that CCRAN advocates for across the country is reducing turnaround time for biomarker testing in cancer care. And I have to say, Andrea, the turnaround time at William Osler is amongst the best in the country. It is truly remarkable what you have accomplished, and you and your team really represent a gold standard of efficiency. So how do you do it?
Yes, I'm pretty proud of our team, our whole department. Our secret is in the staff. Our department is staffed with histotechs. We have no molecular technologists. And where histotechs excel is in cutting these tiny biopsies with great precision. They know how much to cut to preserve that precious tissue. And we took those cutting skills and we transitioned them into the first point of sample preparation for molecular testing, where the tissue is cut for NGS by the same technologist at the same time as the immunohistochemistry. And traditionally, molecular labs are not really associated with pathology departments. If we sent if we sent our cases out, what would happen is it would go to that reference center, go to the pathology lab. The tissue would be cut in one department for things like immunohistochemistry, special stains, what have you. And then it would be sent to another department or even another facility for molecular testing. And it can be handled by multiple people. And these multiple transfers is what leads to a long turnaround time. With that sample being handed off at every step. Our technologists can assess from the block how much tissue they will need to perform NGS, as well as any slides that they need to cut for IHC biomarkers, things like PDL1 and TRAC. And we train them. We trained our histotechs in DNA and RNA extraction, and we expanded their practice by giving them that ability to use instrumentation that was easy for them to understand and to operate without having any previous experience in wet molecular work. And by placing our sequencer in the IHC lab, now we have NGS and IHC samples that are being cut and processed by the same individuals in the same facility simultaneously. And we're able to get results out very quickly that way.
It's remarkable. And it might be helpful if you could just explain a little bit about the difference between IHC and NGS for those watching who may not know those terms.
Absolutely. So IHC is immunohistochemistry, and it is a form of testing, or it's an assay where we are looking at antibody antigen reactions. And it's visualized with another a chromogen that just highlights the cells a brown color. And it's just easy for the pathologist to look at these slides under the microscope. So it's really just highlighting different antigens in the patient's tissue. And NGS is next generation sequencing. So what we're doing there is we are taking the patient tissue and we're extracting out their DNA and their RNA, and we're placing it on a what's called a sequencer, and that instrument will now go through and sequence along the patient's DNA and RNA, and it's looking for any sort of mutations that a patient might have as to what might be driving their cancer.
Okay, thank you for that explanation. I appreciate that. And I do want to circle back to your unique work model in just a minute, because I think that's really, really a critical part of your success. But once again, I just want to bring this back to the patients. Patients are the reason we all work in healthcare. And for the patients, this means your quick turnaround time means that their results will be available at the time of their first appointment with their treating oncologist, and they'll be in the position to discuss the best treatment options for their individual case. So the importance of that really cannot be overstated. And timeliness is essential, and your lab is clearly excelling in this domain. But quality and accuracy are of paramount importance as well. And I know, Andrea, that this is something that your team is also heavily focused on. So could you speak to any quality assurance initiatives that help to ensure the accuracy of these critical results?
Absolutely. So every lab, not just our department, but every lab across Canada has to participate in some form of quality assurance. We need to know that the test that we're performing is accurate and timely, and that we are producing precise results that we can give to that clinician. We have a few organizations such as IQMH, CPQA, which is the Canadian Pathology Quality Association, in Canada that provide quality assurance challenges in IHC, but there were no formal EQA programs for molecular testing. You know, most organizations in Canada subscribe to CAP, or the College of American Pathologists, or they look to European EQA programs for their molecular testing. And our department, Advanced Diagnostics, and William Osler collaborated with the CPQA to develop and provide the first molecular EQA program in Canada. And what's different about this program is that it doesn't only test a lab's ability to deliver accurate results, but also the timeliness of these results and how they are reported to the oncologist. So, you know, they measure turnaround time, which is something that I think other EQA programs do not do. When you're dealing with biomarkers, like you said, time is of the essence for these patients. And you need to make sure that your reports that are going out to an oncologist are precise, are concise, are accurate, but they are also, you know, timely, that they can actually prescribe something for the patient. There's no point in doing a test if you are going to get those results out a month after, you know, the patient needs to go on some sort of treatment. So
Yeah, and that is
very proud of this program that we've developed with CPQA.
And you know, it is an unfortunate reality in many other centers in the country that there is a significant delay in the turnaround time. I speak to patients regularly where, you know, they're waiting sometimes even more than 2 months for biomarker testing results. And this is something that your center is producing with an average turnaround time of really just a few days. Is that right?
It is. And I'll just go back. I want to sort of emphasize on that. So I'll just say the turnaround time before and this was just a couple of years ago, 4 years ago, we had no biomarker testing at William Osler, and we were sending out all our biomarkers to a reference center. But the turnaround time for results from those reference centers was on average 64 days. And when we brought this testing in-house, we reduced that turnaround time to 3 days. And you know, it just shows how, you know, not really sure what I'm trying to say is you need to bring that stuff in closer to home and get that turnaround time done.
Yeah, absolutely. So the in-house testing that you're doing at the community level really helped, it sounds like, to reduce the turnaround time. And yeah, I certainly applaud what you've been able to accomplish in your lab. And you know, in our fragmented healthcare system, there are individual departments kind of scattered across the country that really have developed these models of excellence. And that includes, of course, the Advanced Diagnostics Lab at William Osler. Now, I believe that there could be, you know, potential for other centers around the country to adapt and adopt these models and maybe apply them within their own hospital and in their own context. Part of our advocacy work at CCRAN is to amplify these opportunities. So I'm curious, Andrea, do you believe that your, you know, very unique work model is scalable or would be reproducible in other hospitals?
Absolutely, it is. As a matter of fact, we published a paper on our first year experience entitled Point of Care Molecular Testing, and we showed that this model could be adopted by community hospitals. And really, this novel approach of integrating biomarkers, IHC, and morphology can offer such a rapid turnaround time and really just remove the need for outsourcing these biomarkers. But you need the right resources. You don't necessarily need molecular technologists or PhDs, but what you do need are trainable histotechnologists and molecular pathologists. And you need a system that's easy for the technologists to learn and use. I can say that labs also need the support of their hospital leadership teams to implement this. We were so lucky to have the support of our oncologists. Our head of oncology, Dr. Parneet Chima, was one of our biggest advocates for bringing in NGS. And really saw the potential benefits that this would mean for Osler patients. It's not an easy road, but it's rewarding when you see how your work can save a patient's life.
Absolutely. Yeah. And I think that's really important to emphasize that, we have these novel and these innovative models and leaders like yourself, Andrea, really driving creative solutions in our, resource-strapped environment. And my hope is that other centers across the country can look to what you have done and hopefully reproduce it in their own setting, or at least their own version of it, because patients' lives are at stake here. And the bottom line is we need to do everything possible to support patients and support timeliness of treatment. Now, I know that one of the challenges is about having MLTs come into the lab. And CRAN has called upon the provincial government to increase funding to clinical placements for MLTs. But we do recognize, however, that medical lab technology, is a very broad field. So do you think there's an opportunity for increased exposure to molecular diagnostics in oncology for the MLT students that are currently completing their practicums?
Oh, absolutely, certainly. But at the moment, this specialty that we have here is just a brief overview in many lab tech programs, unfortunately. I often ask the students when they are in our department how much they know about what we do in molecular pathology, and the answer is always not much. We spent one day in school on this. That's all they seem to be getting. And when I say one day in school, they spend one day in school on immunohistochemistry. The molecular aspect of it is non-existent. We are seen as an extension of the pathology rotation, but I think a couple of days in our department is just not enough to give students a good overview of what we do and how they can learn these skills. And I too have been advocating to get students more weeks in a department, in a molecular pathology department, and for schools to include this modality in their teachings. Biomarker testing through both IHC and molecular is at the forefront of laboratory testing right now, and it should be given more of a presence to med lab students.
Absolutely. Yeah. I think we've talked about some of the challenges to timely and equitable access to biomarker testing today, but I think we've identified some potential opportunities as well. So hopefully this is a helpful conversation for some of our system leaders that may be listening. But for MLTs specifically, who may be watching this video today and are finding this really interesting, but perhaps don't have the expertise in this, really subspecialty area, how could they go about receiving training?
Well, honestly, I think they will gain most of their experience on the job. Clinical placement in histology helps them to learn the essential skills of tissue handling and preparation. And this to me is one of the most important steps in sample prep for tissue heading for molecular testing. This is where they can see how histology, IHC, and molecular testing are inextricably tied together. And I learned by attending conferences and seminars. There's not a lot out there formally, so you sort of have to make your own way now to learn. I even watch YouTube videos. There's a lot of good YouTube videos out there as well. But I think I had the best teacher of all in Dr. Sheffield. um, he taught me a lot, and not just myself, but a lot of the techs in our department. We have rounds that we do as well. For interesting cases to help the techs understand and put the whole patient journey together, from the time that they come into the hospital to the time their tissue goes to histology, what we would do with it, and what the oncologist might do with it. So a lot of it is on the job training, and there are resources out there, just not formal ones, unfortunately. So.
Okay, thank you. So as we'll take questions from the audience now. So for those viewing, please feel free to use the Q&A function. But you spoke, Andrea, to the importance of that multidisciplinary collaboration and really driving these efforts forward. And one of the questions from the audience is, how do MLTs collaborate with oncologists, with pathologists, and other members of the care team?
So we do a lot of collaboration with our oncologists simply because they are the ones who are ordering our tests. They are the ones ordering next generation sequencing. And it's also the way that we have set up our department to foster that collaboration and that open communication. So we do not have secretaries or admin assistants that take these requests. We've set up an email box basically for our oncologists to use freely, and that's how they communicate with us, and that's how we communicate back with them. And if they need testing, if they want to inquire about a patient, and at the same time that they are requesting testing, a lot of them also take the opportunity to give us a little bit of background about the patient themselves, and it's also a little bit of a learning experience for the technologist as well. So it's that open communication, but that's how we've set up our department. We also work closely with research. And a lot of our oncologists are also, are involved in clinical trials and research as well. So there's also that aspect. Our pathologists, they're right down the hall. And my advice is go talk to them. They are a wealth of knowledge, and I foster that as well in my staff, to have that open communication with the pathologists. If they have any questions about any cases that they are cutting or that they are, preparing, go talk to the pathologist. It's their case. They know best. And if you have to discuss something, it shouldn't be closed doors.
Yeah, absolutely. Communication and collaboration are so essential in healthcare, and everybody is so busy, but the importance of fostering an environment where those two things are really valued amongst a team can make such a huge difference, as we're seeing with your department. And again, just bringing this back to the patient, that's always my focus. Can you share an example of where your lab's work directly impacted a patient case?
Directly impacted a patient case? Yes. Well, I will use the example of our first liquid biopsy that we ever did. And this patient was a young woman in her 30s, and that was diagnosed with breast cancer. And I distinctly remember the oncologist, I believe it was Dr. Chima, requesting us to please bring in her tissue because her tissue, her biopsy was taken at another center. But she could not wait for the tissue to come in. So she ended up ordering a liquid biopsy while we were waiting. Our technologist did request the tissue in, and we ran the liquid biopsy, and it was New Year's. It was New Year's Eve, I believe, and or the day before New Year's and New Year's Eve, and we ran her liquid biopsy. We found a mutation. The molecular pathologist, Dr. Sheffield, reported it out on New Year's Eve, and that patient was able to start treatment the very next day without having to wait. And she was so grateful. We actually had the opportunity to meet her last year, and she's doing well, and she's still on her treatment. And yeah, so, it was good. We were able to do all of that testing and get her on treatment within a week, or less than a week, actually, within 3 days. So.
Oh, what a heartwarming story. Thank you so much for sharing that. Now you spoke about liquid biopsy. Could you just let us know what liquid biopsy is?
So liquid biopsy is testing or doing molecular sequencing on the nucleic acid that's in a patient's blood. So there are certain indications. It's not done on everyone. Usually, we will take a liquid biopsy if it's a patient has a tumor that you just can't get to, if they've got brain metastases or it's gone through their bones, and you can't really take a biopsy. If it's an older patient that just simply can't go through that surgery to get it, or sometimes the oncologist would order a liquid biopsy if a patient's on treatment and they want to know if there's progression, if there's resistance of whatever it is that they're giving the patient. We will measure because your tumor is shedding. And so what we're really doing is measuring the amount of circulating tumor cells that are in your plasma. So that's pretty much what a liquid biopsy is.
Thank you. Yeah, liquid biopsy is such an important emerging field, and it's impacting patient care, certainly. Can you speak a little bit more about the liquid biopsy project that you're hosting and what the impact may be on patient care?
The liquid biopsy project.
Yeah.
Well, we just started doing liquid biopsy probably in 2020, and we're still only doing it in-house for now. Working on making that assay a little bit more sensitive, and so we can offer it to a wider group within Ontario. So it's a work in progress right now.
Oh, exciting innovations happening at Osler. I love it. Now, what's one common misconception about MLTs or about lab work that you'd like to clear up?
Oh, are there misconceptions? I don't know. I think everybody well, for one thing, I think a lot of people in the hospital don't even know where the lab is.
Right.
And they never see lab techs. If you say you work in a hospital, automatically they'll say, "Are you a nurse?"
Yes.
And lab tech never comes to mind. But I think maybe one of the misconceptions is that they think all lab people are introverted and kind of don't want to talk to the public. And so that's why they got into this field, because they're always sort of behind the scenes, and I don't think that's true. We have wonderful lab techs who know so much and are so knowledgeable and you know, love to talk to a wider audience. It's hard to get that opportunity though, but we're all not little moles that are in the back there.
Yeah, I think that's so important. And exactly as you said, you're not just these unseen people in the basement of the
Yeah.
hospital. What you're doing is absolutely critical for patients, and I'm sure you're very much driven by improving the patient care experience as well. So as we wrap up, I would like to thank you so much, Andrea, not only for chatting with us today, but for the work that you do each and every day to better the lives of cancer patients in your community and beyond. It is such an important field, and the work that the MLT community does is often unseen or under-recognized, as you spoke to. So I believe it's so important not only to highlight MLTs, but to celebrate them, as is being done this MLT week. So thank you again for the opportunity to have this conversation today. And I'll just briefly pass it back to you, Andrea, if you want to share any final thoughts before we go back to Champika.
Thank you. So I just want to say thank you so much for having me. This was wonderful, and I hope I shed a little bit of light on what we do in the lab here, and that our job really is unseen, but just so very important. And thank you again for having me, and I wish all our lab techs a very happy Med Lab week.
Thank you so much, Andrea and Cassandra, for your time and for such an insightful conversation. And thank you to everyone who joined us today to celebrate Medical Laboratory Week. We hope this event gave you a deeper appreciation for the essential work that MLTs do every day, especially in the field of cancer diagnostics. From behind the microscope to the front lines of innovation, their expertise truly drives better outcomes for patients. And before we wrap up, I have a few quick reminders. If you'd like to stay connected and hear more about upcoming events, research stories, and innovations at Osler, please follow our brand new ORIHI LinkedIn channel. We'll be posting highlights from today's session there as well. And mark your calendars to celebrate Research Week happening November 17th to the 21st. It's our biggest research showcase of the year, and we'd love to see you there. Once again, happy MedLab Week to all the incredible medical lab professionals out there, and thank you for everything that you do. And that's it. Have a wonderful afternoon, everyone.
Thank you.
Yeah.